Thank you so much, my good friends. So I'm gonna go ahead and do the cranial blood vessels, arteries, and veins, and then you guys can chime in if you know, because the answers are on the board. So we start with the cranial veins, since this is what we did. What would this be?
That would be the transverse jugular vein.
So this would be the transverse jugular vein. What about this one out here?
Posterior facial vein.
This one.
External jugular vein.
External jugular vein. My good friends, we have started here because come now we're going to the circulatory system. I just wanted you to get a bit of experience making those incisions, but now let's focus on the circulatory system because this is what's going to matter for you guys. Okay? Okay, my good friends. So what is this one right here?
That one
would be the
external jugular.
This one is the external jugular vein, remember? Yeah. But this one on the inside is the internal jugular vein. Okay? So there's that. So I'm gonna kind of remove this right here. This is part of the thymus, okay? Okay, so what is this?
Is that the
this one? Oh. This is the superior jugular vein. My good friends, stop putting your cats away. You should be doing this. You can put them away after this because you know we should be listening here. Putting your cats away. This is the superior vena cava. It's on the board. Superior vena cava.
Yeah, but the other one?
The brachiocephalic vein is on the board in red.
Okay.
So this is the brachiocephalic vein.
Okay.
You understand? So brachiocephalic vein on that side. Okay, brachiocephalic vein. This is the external jugular vein. Okay. This is the subclavian vein.
Yes.
You understand? So subclavian vein. Subclavian vein, and this one kind of came too fast. The branch to the subscapular vein, you see it? It kind of came too fast. So up to here is the sort of the subclavian vein. So this cat, the configuration is just a little different, you know, and you should expect that when you're doing surgery. So then from somewhere here would be the axillary vein, and then once it passes this, there's the brachial vein. Okay, same deal here. This is the
Vena cava.
superior vena cava. And this is the aortic arc, which is kind of hidden here. Yeah. So this is the aortic arc, aorta, pretty much.
Looks like muscle.
This one? Mm-hmm. This is the aorta, though. You see? Mm-hmm. You know what I should have done? I should have removed this. No. I should have removed the pericardium. I didn't get a chance to do that. My good friends, come here. I know we're going to be a little late today. I'm sorry. But I'm just trying to fit in as much as we can into this, okay? So I'm just removing the pericardium just to show that aorta. I'll show you that it's definitely the aorta.
It's more vibrant when that's cut off.
It's more, you know, evident. You could really see it when we remove the. You see, there's just a bit of fat here.
How do you know that that's just excess fat?
It's excess fat, yeah. I mean, you know, because the heart is surrounded by some fat, but this one happened to have here. You see where the aorta is? And then this is the brachiocephalic trunk. You see what I'm saying? My good friend, you're packing away. I know you want to go, but you could quickly pack so you can leave at 12. Okay, I see what you mean. Because I know we're kind of running late. And then you could see the phrenic nerve. You can see that. My good friends, are you coming? You see the phrenic nerve going to the diaphragm. So there's the phrenic nerve. You see it's right here on the diaphragm.
And it's kind of tough, isn't it? Like
Yeah, it's a nerve. It's a stringy nerve. This is the phrenic nerve, for sure. Do you see how it's attached to the diaphragm? Yeah, and it runs along the inferior vena cava. So I had to pry it off of there. You understand, my good friends?
Yeah.
My good friends, we're seeing some good things over here, and you guys are not able to see it, but hopefully you will watch the videos. There's the other phrenic nerve for the other side. Do you see it? Do you see it, my good friends? There.
Yeah.
The phrenic nerve for the other side. So my good friends, I do apologize, but sometimes it's the nature of the business. So there's our pericardium, so you could see it properly. So this is why I was saying this is the aortic arc. You understand? You see? This is the aortic arc. And this is the brachiocephalic trunk.
Gets a little messy.
It gets a little messy. And then being left subclavian artery. I just have to clean it a little bit. And then, of course, the internal mammary artery. You see here? Do you see that?
Oh, that little one?
Yeah, this is the internal, because it's coming from the left subclavian artery. Do you see it? This is the left subclavian artery. Yeah, coming.
It's kind of not that red, huh? It's kind of pink.
It's it's kind of because it was covered mostly by the connective tissue, which is whitish, and it was now that I've removed the connective tissue and the excess, you see, it's a little bit more red.
Yeah.
Okay. This one is also, so there's the brachiocephalic trunk. You see what I told you? In the cat, the brachiocephalic trunk will give rise to the left and right common carotid.
That's where it separates.
Mm-hmm. You see what I'm saying? Looky here. Do you see it, my good friends?
Yeah.
Do you see it? So this is the brachiocephalic trunk. We have to scoot around this. See, brachiocephalic trunk. So there's the right common carotid, right? And then there's, the left common carotid here, coming from the brachiocephalic trunk. And then this is the right common carotid. And so this is the subclavian. And there's the other mammary gland, internal mammary. Remember I was saying it looks like breast, nipples. You see what I'm saying? So just needs a little cleaning. So this is the right subclavian artery. This is the left subclavian artery, brachiocephalic trunk. And then the brachiocephalic trunk gives rise to the common carotid on the right and then the common carotid on the left. But they're branching from this brachiocephalic, so they're just common carotid. Okay? So there's the common carotid artery together with the poorly infused internal jugular vein on the right and then the common carotid on the left. You don't have to say that though, because they are both coming from the brachiocephalic trunk. Okay? And then there's that. And like I said, you don't see where it splits, but you do see the transverse jugular vein, anterior facial vein, posterior facial vein. You see anterior facial vein on this side, posterior facial vein on that side, subscapular vein, subscapular artery. Okay? So this is it. And then the thyrocervical is going to kind of come somewhere here. And then here is still the right subclavian artery. And then after this, then this becomes the axillary artery, right? And this is the subscapular artery. You understand? And then the brachial artery starts from here, going downwards, just like the brachial vein. Okay? I want to see the thyrocervical. The thyrocervical on the left is one we normally see. You understand? So it will give rise to the transverse scapula. Let me see if we get a thyrocervical. There's the thyrocervical on this side. It's kind of sort of purely infused. You understand this one? And then here you might see a branch You see, there is the transverse scapular artery and vein. Do you see it, my good friends? Look here. Do you see it? Yeah, the blue is the transverse scapular vein from this, and this is the transverse scapular artery. Do you see that? This one, the red and blue, and then there's our little transverse scapular artery is very thin. You understand?
Thinner than that one right there?
It looks like. Where could it be? There's the transverse scapular artery right here. You see this? And this is still the right subclavian artery. So we have to look for the left one over here, maybe somewhere here. You see? There's the left one, transverse scapular, the thoracocervical artery. And so there's the thoracocervical artery that's giving this branch here, which is the transverse scapular artery. Okay? We kind of sort of, and then of course the inferior vena cava, and this, you see the phrenic nerve, and then the phrenic nerve on this side. You see how it's going to the diaphragm? See this phrenic nerve? It goes on both sides, and they both go alongside the inferior vena cava, which is this. And there's the azygos vein being, do you see it? It goes into the, superior vena cava just before it enters the right atrium. So there's the azygos vein. The internal mammary could be somewhere here, my good friends. I apologize. So the internal mammary would have been here. There's only a small stump. You see this configuration, it was really torn off when we were doing, but you see, sometimes it comes off as one, then it branches like this. Instead of coming like the first time I drew it like that, coming off as one branch that splits to supply the breast. Okay, so internal mammary vein is this, and then azygos vein is this, superior vena cava, inferior vena cava, and here, this subscapular vein kind of branched too early, you know what I'm saying? So there's the subclavian, maybe very short over here, subclavian, and then axillary, subclavian vein, brachiocephalic vein, external jugular vein, okay, and then there's our transverse scapular and artery and vein, and then but they're separately. Usually in the I do them separately, okay. So I think I'll stop this for the cranial arteries. I kind of went through basically most of them, but can you just switch it off?